Good afternoon, and thanks for joining us today for a COVID update. Today in Colorado, we have 776 new cases. We currently have 355 Coloradans hospitalized for COVID-19. We also want to remember the people we've lost, 5,927 Coloradans who died from COVID, each one a friend, a sister, a brother, mother, father, and or uncle. And my heart goes out to those who are mourning the loss of their loved one here in Colorado, across the country, and across the world. Our numbers seem to be stable, but they're stable at too high a number, one that means that more Coloradans will continue to die from this terrible pandemic before it's over. And these trends are not a sure thing. I think what is sure is that as we await the good news on vaccines, and it's soon to be coming, and we'll update you on exactly where we are. It's very important that Coloradans wear a mask and stay 6 feet apart from others whenever they can. We've had enough misery and loss and death, and it's within our ability to help minimize that in the final months of the pandemic. 5,927 is too many Coloradans, and we owe it to ourselves and others to prevent additional unnecessary loss as we enter the final months of the pandemic. With each new day, more and more vaccines are getting into arms. Highly effective, safe. We've had about 988,789 Coloradans have gotten their first dose. That's more than 1 in 5 of people over 18, and 500,102 second doses. Since we received that very first dose of the vaccine in mid-December, and I got to go to the Veterans Living Facility to see some of our Korean War and Vietnam veterans receive the life-saving vaccine, we've been racing against the clock to get the vaccine to those who are at highest risk, the most vulnerable, ending the pandemic, reducing lives lost, ending the threat of overwhelming our hospitals. And as you know, we set a very bold goal of vaccinating 70% of Coloradans 70 and up by February 28th, this last weekend. And we set it knowing that it would be a stretch to reach there, because I wanted to set a stretch goal. I didn't want to set a goal that was too easy and that we would pass early. We didn't want to set one that was impossible to reach based on the numbers that we knew were coming. We wanted to set a goal that if we hustled and worked hard, burnt the candle on both ends, we could achieve by February 28th. And now we'll be announcing what we were able to do by February 28th. Drum roll, please. Okay. By February 28th, we vaccinated 70.7% of people 70 and up in Colorado. That's 397,531 Coloradans aged 70 and up. I want to thank the team with Scott Bookman, General Sherman, all of our hospitals and community health clinics and county health departments, pharmacies, so many others. I want to thank the volunteers who worked at clinics to protect our most vulnerable, working around the clock to get shots into arms. Colorado, 70.7% of people aged 70 and up have now been vaccinated. And I really hope it doesn't end there. While across the whole population, we would be thrilled to reach a 70% number. I hope there's more folks out there 70 and up that are willing to roll up their arms and get the vaccine, folks that might have been sitting on the sidelines. You are still a priority. You are still prioritized. When we can find people 70 and up who haven't had the opportunity to have the vaccine, we want to make sure you have that opportunity this week, as soon as possible, tomorrow, the next day. But I am thrilled that we reached over 70% of people 70 and up. And again, across the whole population, that's a number that ends the pandemic. We'd be thrilled with 70%. We do hope that people in their 80s or 90s, if for whatever reason they haven't gotten it yet, please, you are a priority. You are at highest risk. Please get that vaccine in the next week or two. As you know, people over 70 and up have represented 78% of the deaths in Colorado from COVID, just over 40% of the hospitalizations. So we've made tremendous progress towards protecting folks that will significantly bring down the death rate and in a significant way reduce the hospitalization rate as well by about 40% as those folks are protected. Keep in mind that everybody 70 and up is not protected yet. Some got the vaccine last week, some 2 weeks ago. Remember, it takes the 2 doses. Some are waiting their second dose. They might get in a week or two. And then 2 weeks after that second dose is when they have the very, very high level of protection. And we hope that they're able to resume their lives, their normal lives, social lives with confidence, knowing that they have the very best protection that modern science can provide. That sort of tragic number, 78% of our fatalities over age 70, is the reason we've prioritized our most vulnerable, those at highest risk from the virus, those at hundreds of times the risk of healthy people in their 20s. From day one, we've approached vaccine distribution in a way that saves the most lives, is equitable, and ends the pandemic as soon as possible. That has been our guiding light, and we are proud to be at 101% of that goal by February 28th of vaccinating people age 70 and up. As you know, if you're 65 and up, you can now get vaccinated anywhere in Colorado. And then on March 5th, this Friday, it will open up to people age 60 and up across our state. Again, that doesn't mean if you're 61 years old, you can automatically get it Saturday. We'll walk through the vaccine numbers, but it'll take several weeks. It'll take several weeks. So some people who are 61, 62 will get it Saturday and Sunday. Some will get it the following week, some the week after that, and some the week after that. There's simply not enough vaccines for everybody who's in an eligible group to get it all at once. So please be patient. You will get it. And we are making great progress on 65 to 69. They have this window through Friday, and then on Friday it opens up to 60 and up. But of course, people over 70 will continue to be prioritized, and there are still many people 65 to 69 who are waiting to get it, who will get it in the coming weeks as well. And we're excited by some of the announcements around new vaccine supply that I'm going to walk through. We're very excited that we will receive our very first doses of the single dose, the highly effective and safe single dose regime, the Johnson & Johnson vaccine. We're going to get about 45,500 doses this week, and we plan to get nearly all of those into arms by Sunday. That's our goal. We're going to get them, and we're going to use them within a few days. We also know, based on a call with the White House this morning, that there will likely be 0 Johnson & Johnson doses the following week. And then the week after that, perhaps a small amount. It could range anywhere from 0 to a similar amount to what we got this week. And then finally, those supplies will increase dramatically in 2 to 3 weeks. And the White House estimates that by the end of March, there will be about 5 to 6 million doses that are distributed each week across the entire country. And that one dose, we're distributing the 45,500 across the state. Very much looking forward to that. It's logistically easier with one dose than 2. And we're excited to add that to the arsenal of weapons that will allow us to defeat this deadly virus. This morning, I was on a call with the White House and governors. I want to walk you through the vaccine forecast, same information we have. Next week, the national supply of Pfizer and Moderna is increasing by 700,000 doses from 14.5 million to 15.2 million that ships next week. That means 11,500 more doses for Colorado. That's a total of about 256,880 doses next week. We expect there will not be Johnson & Johnson next week. We'd be thrilled if there's some. We expect none based on the conversation. The next week, you can see the numbers here. It'll go up to about 270,400. We don't know if we're going to get any of Moderna and Pfizer. We don't yet know if we're going to get any Johnson & Johnson that week. If we did, we would expect it to be small, like this week or less. And then the Johnson & Johnson will start to kick in, so as well as the Pfizer and Moderna continuing to going up. So you can see that by mid-March, early April, we'll be approaching 400,000 doses a week. And that's why a lot of our efforts of the state have been to set up the 6 pods across the state to be ready to come online by the end of March, ready to make sure that if we're in a position where we get 400,000 doses, which we hope we will be by the end of March, early April, we will use all those within a few days, within the week that we receive them. They don't do any good sitting on shelves. We need to use them to end the pandemic, return to normal, save lives, and that's exactly what we're going to do. Of course, these numbers presented to us are subject to change. We'll continue to provide any updates we get from the federal government on these numbers. But news of increasing supply is a very, very good thing. And we're setting up the large vaccination sites across the state. and I'm confident that we'll be able to deploy 400,000, 450,000 vaccines a week when we hopefully reach that cadence in late April or early April or May. Last week, we also announced when we were expanding access to different groups. Obviously, March 5th, this Friday, anybody 60 and up can get the vaccine. Also, people who are at extremely high risk that are 16 to 59. So if they have two significant risk factors and are medically indicated, they're eligible to receive the vaccine. And we will be able to start on some of the food workers, Cargill and JBS, some of the groceries that have pharmacies, and then, of course, the large group of food workers, restaurant workers, and many others beginning just 2 weeks later. We will have the pods hopefully up and going at that point, and a way to vaccinate restaurant workers and bus drivers and food workers across the state that aren't at a large facility that can do a site-based clinic, and many more. We fully expect that our 6 pods across the state will be ready in late March. They're going to be the cornerstone of this, continuing to, of course, work with our health providers and community health clinics, but their capacity is expected to be maxed out. And, of course, to be able to successfully deploy the 450,000 a week, we will need a great network of these large centers that we're setting up to be able to do that. In the meantime, we are able to do some on-site delivery of vaccine to food workers. So we will be at Cargill, and I'll be joining. I'll personally be there at Cargill and Fort Morgan this Friday, and I'll be at Greeley at JBS this Friday. We worked very closely with the workers and the companies to be able to have those clinics ready to go. And if you're eligible soon, if you're 60 and up, for instance, you can start signing up by Friday. So I know people are saying, how do I sign up? Right now, again, it's 65 to 69 to be clear. So that is who's signing up. You can sign up now. But very soon, people with two pre-existing conditions or 60 and up, all of our partners expect that they will have that sign up live by March 5th, by the time it goes live for that group. Some might get it live Wednesday or Thursday for the signups, right? You're not going to be called in right away because you're not eligible till at least Friday. And many providers are actually starting Saturday with that new group instead of Friday, which is fine. But if you're frustrated that where you're trying to sign up doesn't work yet, it's because they're still working through 65 to 69 and 70 and up, maybe teachers. And so, just have patience. But you'll be able to sign up by Friday if you're 60 and up or have 2 significant pre-existing conditions on any of the provider sites that include pharmacies, community health clinics, hospitals, local centers that are small scale, a wide variety of ways to sign up. And of course, if you're looking for information on how to sign up, we first suggest you go to the website, covidvaccine.org. Very simple, links to providers. You can pick one in your area. I was texting a lady last night, 65, and she couldn't. And I just sent her the website, and she found a pharmacy appointment to set it up. Very easy. You can also call 877-CO-VAX-CO. And this is especially if you're watching this and you're not comfortable using the internet. By all means, call 877-CO-VAX-CO. That is for you. Don't feel guilty. If you know how to use the internet, by all means, sign up, follow the links, pretty easy. But if you're having any trouble, please call the 800 number. Wait times are minimal, down to a minute or 2 most of the time. And they're happy to help find some providers that can take your phone call rather than signing up on the internet, depending on where you live and how far you want to drive to get the vaccine. We are fast approaching the 1-year anniversary of the very first case of COVID-19 in Colorado. And it's time to really reflect on where we've been, where we are, and of course, where we're going in the coming months as we bring an end to the pandemic through the highly effective and safe vaccine. The things that have saved lives and prevented disease transmission these last 12 months are even more important now than ever before. The declines across the nation and in Colorado have leveled out. In some states, the rates are increasing again, inevitably followed by hospitalizations and deaths. We do not want Colorado to be one of those states. So what do we need to do? You all know at this point, but we can't be tired of it yet. Wear a mask, social distance, stay 6 feet apart from others whenever possible, limit your social interactions. I'm confident that summer will be very close to normal based on these vaccine predictions that we have today. We are very hopeful that people who want the vaccine will be able to access it in April and May in time to have a summer that allows them to enjoy everything that Colorado has to offer. It all depends on the supply of vaccine. I'm expressing, of course, optimism today based on the conversation with the White House, but anything could happen along the way, including additional mutations or variations. But from where things look right now, as long as we can get through the next couple months and continue to be cautious and careful, we can avoid overwhelming our hospitals, avoid another wave in Colorado, avoid unnecessary loss of life of our brothers and sisters and aunts and uncles, and be prepared to fully enjoy what Colorado has to offer very soon. I'm proud of the progress we made around vaccine distribution, but of course we can't claim victory yet. We need more vaccines. It's because of the actions that you as Coloradans are choosing to take that we are seeing lower case rates than many states across the country. And it'll also be the actions of Coloradans, namely choosing to take the vaccine when you're eligible, that will bring an end to this public health crisis. I want to thank you, my fellow Coloradans, for your hard work, the sacrifices you've made socially, psychologically. But you know what? We need to keep it up just a little bit longer. I want to thank all of you for everything you've done and will do in the coming weeks and months to put an end to this horrific pandemic. Thank you, and I'm happy to take some questions.
Governor Polis, it's David Clue with Denver 7. There are plenty of people out there who will not allow a Johnson & Johnson product into their arm. Can people request a specific vaccine maker over another when setting up an appointment? And if so, how do they know who's providing what vaccine? And if you're allowing, I do have a follow-up.
Support full transparency so when people know what vaccine is at a site, when they are setting up an appointment to go there. That doesn't mean they can choose. It's very likely that site only has one because they operate with one in the protocols, but they will not, when they're signing up for an appointment, they will know what they would get at that. And if it's not the one they want, they can sign up at a different site at a different time to get the one they want. It might be a week or two later. It just depends on how far they want to drive. But all three are being deployed across the state. It will be visible to consumers which one you are getting at which clinic. It should be already, and it will be even more going forward because we want to make sure all of our partners make that visible. Let me just add, all three vaccines, highly effective, safe, save lives. All of them are almost 100% effective in preventing death from COVID-19. And in fact, in some of the experimental groups, 100% effective. That's all three, right? So you see different numbers. Does it prevent infection or whatever it is? Nobody wants to get infected, but what you really want to do is not die and not get severely sick or intubated. They are all very close to 100% effective at accomplishing that. So yes, you can absolutely look at which one is available at which site. If for some reason you want a different one, you can set up a different time at a different place.
Thank you, Governor. This next question, I apologize, is a little off topic, but it is something we're following. Are you considering a pardon for Candace Bailey? And do you think somebody with a felony conviction should be able to run for office?
Well, we have a process around pardons and clemency. I've really assembled a great clemency board from across the state, including members of law enforcement, people who themselves have been granted clemency, representatives of victims. And every time there's an individual application, it goes to the group of folks who really dig in and advise me on the details. And then, of course, we make a final decision in each case, and we don't discuss cases that may be in the middle of that process.
Dr. Fauci said recently that he thinks mask wearing will possibly continue into 2022, but you're talking about, a summer that's pretty close to normal. Can you kind of talk about that discrepancy? And then also, I just wanted to make sure I understand the numbers right. It sounds like by the beginning of April that Colorado's vaccine distribution will be almost double. Is that about right?
Double what it is now, you mean? By the end of April? I think that looks about correct. At least double from where it was a week or two ago. Although, yeah, the Johnson & Johnson adds significantly to that too. It actually adds more than you think because it's a one-dose regime. So the others, Moderna and Pfizer, when you see the numbers, they're split between first and second dose. because of the increasing numbers, there's going to be a slightly higher amount that are first dose and second dose, but maybe it's 60-40 first dose versus second. Johnson & Johnson single dose. So in many ways, you could have the others or double that as you look at that. But in terms of the number of Coloradans who will newly be able to get vaccinated, that number should roughly double. What was your first question? Oh, yeah. Look, I think that, some Coloradans will choose to wear a mask. I hope that, for general public health in many years in the future, if people experiencing a cold or flu symptoms, it would be good to wear a mask to prevent that from spreading to your loved ones or those that you encounter. It certainly is a effective way to do that. Based on what we see with this vaccine data, as long as the vaccine continues to be effective, and based on these numbers, I expect the pandemic phase of this will likely be over by this summer. That doesn't mean that the disease goes away. Measles exists, mumps exists, swine flu exists, bird flu, all these things exist. The coronavirus will exist. It'll likely remain endemic for centuries in our state. But when we reach that close to that 70% number, of people vaccinated, which, based on what we know, we think will occur sometime in May. And then, again, immunity shortly thereafter with the second dose, depending on the vaccine. Some people will wear masks and some won't. I don't think that, when you're in grocery stores in June and July, you might still very well see people wearing masks, but I don't think they'll be the majority.
Hey, Governor, this is Gabrielle from Fox 31. Two quick questions for you. One is just for clarity. I remember once upon a time we talked about the J&J vaccine for the homeless community. So now that it's here, for those experiencing homelessness and incarceration, will they still be getting the vaccine according to their age and their health status?
Yes. So everybody 60 and up will be able to get the vaccine starting this Friday. And when it opens up to a new group, we always immediately make that available to those who serve the most at risk, including those who are in state custody, including members of the population experiencing homelessness. We then expect that in late March, that will go to 50 and up. We also will look forward to working with those who serve people experiencing homelessness to help identify those that have 2 or more pre-existing conditions who are at additional risk of any age, and therefore are eligible March 5th to receive the life-saving vaccine.
Okay, got it. And the second is a little off topic, but you declared the 20th as Meat Out Day, prompting some in Weld County to declare that same day as Meat In Day. So do you have anything planned for ranchers, and what's your plan to sort of repair relationships within that county, seeing that some of them want to be a part of Wyoming?
Well, I look forward to, of course, being in Greeley this Friday. We're going to be providing the life-saving vaccine very early in the process for those who work in meat processing, which is so critical, not just for our ranchers and ranching communities, but also for consumers and for the food industry, for restaurants, for consumers. The role that JPS plays as a critical piece of our food infrastructure, and also in many ways ground zero for some of the dangers that the virus presents, having experienced great loss at the plant, even brief periods of closure. We're very excited that we'll be able to offer the life-saving vaccine to the workers there to make sure that we can continue the uninterrupted food supply for Coloradans, as well as making sure to serve our ranchers across our state.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, en español, a la espera del cargamento de vacunas de Johnson & Johnson y con el inicio de una nueva fase de vacunación en el estado, ¿existen suficientes dosis para inmunizar a todos los beneficiarios?
Sí, esta semana estamos esperando recibir 45,500 dosis de Johnson & Johnson y esperamos recibir más al final de mes. Vamos a tener tal vez 2 semanas que no vamos a recibir casi nada de Johnson & Johnson, pero esta vacuna va a regresar en la última parte de marzo y vamos a recibir cientos miles de dosis de Johnson & Johnson. Todavía necesitamos más dosis en nuestro estado para servir a toda la comunidad, todos los coloradenses. Pero Cada día estamos un paso más cerca de terminar esta pandemia y todos de los 3 vacunos son muy seguros y efectivos.
Hi, Governor. This is Joe Vaccarelli at Denver 7. I have 2 questions, if that's okay. First off, as we move into vaccinating people with pre-existing conditions and certain essential workers, will they need to show any sort of like doctor's note or proof of employment or anything at their appointment, or is it more on the honor system?
Yeah.
Like a system in place? Or?
Yeah. So fortunately, those who are experiencing pre-existing conditions, they're already, by and large, by nature of their pre-existing condition, they are seeking medical care with providers. So we are working with and trusting the medical professionals, the chief medical officers, those who are part of those medical records at the major hospitals to make sure that they can prioritize based on saving lives those that have the conditions that put them most at risk. There will, of course, also be a way to self-attest to those pre-existing conditions, but the proactive piece around the targeting will be done by the medical care providers who know their patients the best, with the lens of saving the most lives for those who are most at risk from this deadly virus. Did you have a follow-up?
And I did. My second question, a little off topic, but we've gotten a lot of response from a story we did recently about storage units and evictions regarding that. With people not being able to keep up with some of the rents or increasing rents, I mean, would your office support a temporary moratorium on any storage unit evictions or rent increases?
You're talking about storage units, not where people live, right?
Right.
Yeah. Well, currently, what we have with regard to people's residence, because while while at least your possessions could be saved in storage, you still would be experiencing a very difficult time in housing. We want to keep people housed wherever possible, first and foremost. That's why in Colorado, the federal moratorium is in effect. We also have a state order around penalties to make sure that there aren't such enormous penalties that rack up, that even if people who can pay the rent lose their home just because of they were waiting for a federal stimulus check or waiting for an unemployment check, right? So once they get that check, they can pay their rent along with a modest penalty. But we wanted to make sure there wasn't a penalty at the level where they would effectively lose, their ability to remain housed. We, of course, want to look at predatory practices across other industries, including storage, to make sure that nobody is taking advantage of consumers in their time of need.
Governor Marshall Zellinger at 9 News. Non-COVID topic. Xcel Energy executive sent you a letter this weekend explaining the company's need to buy natural gas and electricity at $650 million more than anticipated. If the PUC approves, gas customers would pay $7.50 a month extra for 2 years, and electric customers would pay $3.50 a month extra for 2 years. Are you comfortable with Xcel's explanation about the need to buy so much on the spot market? And do you think Xcel should have to eat any of that cost and not be allowed to pass it on to customers? Yeah,
first of all, this isn't just about Xcel. In fact, Xcel has less cost per customer than some other Colorado utilities. And obviously expanding the conversation to both other regulated utilities like Black Hill, as well as municipal utilities like Colorado Springs Utility, which also suffered additional loss. Certainly, in my opinion, as I expressed in my letter, before any utility wants to pass along the cost of increased natural gas to consumers, they should have shown that they've gone through everything that they can do to reduce natural gas usage during a peak. What does that mean? They basically need to proactively ask their customers to cut back. And there were some utilities in Colorado that did that. And guess what? The customers did cut back. So I don't think utilities should approach the state and say, we want to charge consumers, when during the period in time, they weren't even out there notifying people, please cut back, turn off your lights, decrease your temperature by 3 degrees, because that is a very simple, easy way to show that, yes, you can reduce usage. If after all that, every step you can within reason you've taken to reduce usage, if there are still costs because of short-term volatility, then it's a fair conversation about the proper allocation between shareholders and between customers. But I, as governor, want to do everything I can to protect customers. We are not Texas. Consumers should not be expected to shoulder unexpected exceptional costs without first being advised to reduce usage.
Hi, Governor. Jason Gonzalez with Chuck Colorado. On the issue of K-12 standardized testing, do you support asking the federal government for a waiver to CMAS on the basis of using district level?
On the basis of what? Okay.
District level assessment.
District level. Oh, well, look, that's the federal government had ruled that out in their announcement around waivers. I think that if Colorado is going to craft some sort of waiver requirement, it would need to be narrowly tailored to meet the federal criteria for approval. Of course, we want to know where students are at this year. What parent doesn't? What school district doesn't? I want to work with the State Board of Education, with legislators to make sure that we're able to prioritize identifying where those gaps are and what resources we need to make sure that every child is able to accomplish a year worth of learning.
Hi, Governor. Ali Levine with 9 News here. You've said providers will be ready to register the new group of eligible Coloradans by Friday. I believe I also heard you say some will need until next Wednesday. Can you clarify that quickly? And how much of a heads up do providers get ahead of your public announcement Friday regarding changes to the distribution plan?
Yeah, I don't think I said anything about the next Wednesday. All the providers will be able to accept signups for people in the March 5th group by March 5th. Some are already doing it. Some go quicker than others. Some are doing it tomorrow, Wednesday, Thursday. I might have referenced this Wednesday. I said some providers will be taking people for the March 5th group to sign up this Wednesday. Doesn't mean they get the shot this Wednesday. It means they could sign up for an appointment the following Sunday or following Tuesday. But yes, in our conversations with our partners, they've all expressed that they will be ready to take signups for Coloradans 60 and up, people with 2 comorbidities who are at greater risk, by Friday, by the go live date of the additional group. Every time there is a change in sequencing, and we never know the exact dates because these are estimates of vaccine supply that I gave you today. We're not going to base the actual date on estimates. We're going to base it on actual vaccines. So, right, we have the date March 21st. That could be March 19th. It could be March 22nd. It depends on the actual number of vaccines we get. The March 5th date, we know the vaccine flow this week. We know exactly where we are. We know it's March 5th, and that's the day it goes live. Providers will all be able to take signups by March 5th for people 16 up and people with 2 existing conditions that put them at great risk from the virus.
Hi, Governor. Seth at the Gazette. 2 questions for you. First, there's been some criticism from restaurants about the change to that priority. Wonder if you have a response to that. And second, as you sort of look back over the past year, curious if there was anything you would change if you had the ability to in terms of the state's COVID response. Thanks.
Yeah, we always want to be fully transparent, and we want to make sure that people know when there's actually the vaccine to begin getting vaccinated. So rather than say, every group can go on a certain date, but by the way, there's no one in that group that can get vaccines for 3 weeks because we're still working on previous groups. Yes, we open it up before the previous groups are done, but we've gone enough through those groups where at least some people in the new group are able to get the vaccine. So the soonest possible date for the large and very decentralized restaurant workers of the state, March 21st, they can start getting it. We'll have the pods set up across the state. There'll be an orderly way that they can access it. We'll have enough vaccines for folks to do it. Had we or others said, okay, the date is March 1st or March 5th, it might sound good, but there wouldn't actually be any restaurant workers that were able to get the vaccine. It would be actually much more frustrating for those that are eligible March 21st to pretend like they're eligible now and say they are, but in fact not have the vaccine or not even have a place to get it because the pods aren't even open yet. So that was the answer to your question. What was your second one?
If kind of looking back over the past year, if there's anything you could change in terms of the state's COVID response.
Well, look, this has been a horrific year for the world, for the country, for our state. We've done better than many other states. Our death rate significantly lower than the national average. Our economy is building back faster. We were one of the first states to reopen, and we continue to really lead the way in terms of making sure that people are able to do what they want to do in a safe way during a pandemic. So in this final stage, our task is to get vaccines into arms to end the pandemic, and meanwhile to make sure that Coloradans continue to persevere in wearing masks, keeping a distance from others, and staying safe in these final months to avoid another deadly wave of the virus in Colorado. We're already seeing it going up in a few states across the country. We really don't want Colorado to be one of those. And that decision is in your hands, in our hands as a state. The individual decisions that we make will determine the fate of our fellow Coloradans. Thank you.